5 vegetables and fruits that act like natural insulin to help control your blood sugar. Quickly, hello health warriors, let's take a look at the following foods and see how they can effectively and safely control blood sugar for people with diabetes. Diabetes is one of the most obsessive diseases for many people. The disease is common in older people. After 50, the body is prone to metabolic disorders, causing elevated blood glucose levels. It's caused by a body deficiency in insulin secretion or resistance to insulin or both, leading to significant disorders in the metabolism of sugar, fat, and minerals. When you get sick, you need to take care of your blood glucose control. Diet has a strong influence on blood sugar levels and the health of people with diabetes. So we should be supplementing with foods that control blood glucose in the body. Among them, the 5 vegetables below are foods that are well known for their ability to prevent the risk of diabetes. 1. Beans. Many people consider beans to be green ginseng for human health because they possess an abundant source of nutrients. Beans contain a lot of nutrients thanks to their high levels of vitamins A, C, B, as well as calcium, magnesium, potassium. In particular, beans contain a compound called myricetin. This compound has the ability to reduce blood sugar by increasing glucose absorption from muscle cells. In addition, beans can stimulate the pancreas to produce insulin needed by the body. Regular use of beans can help significantly reduce triglyceride levels in the blood, thus playing a role in preventing the complications of diabetes. Beans contain a significant amount of soluble fiber, which increases viscosity in the stomach and intestines. This viscous substance is very beneficial to the digestive system, helping people with diabetes to feel full for longer. At the same time, the use of beans also helps slow down the absorption of glucose from the stomach into the bloodstream after eating, keeping blood sugar levels stable. Studies have shown that extract from beans has antioxidant abilities and helps reduce stress. Stress control is an important factor in the treatment of diabetes because when people regularly experience prolonged stress, it can lead to a sudden rise in blood sugar levels. Adding beans to the diet can boost the recovery process, minimizing the feeling of fatigue for people with diabetes. When you combine a daily consumption of beans with a reasonable exercise regimen, you can maintain longer workout times. This helps to effectively control the symptoms of diabetes. The use of beans to support the treatment of diabetes is well-founded. However, beans are only capable of stabilizing blood glucose and preventing the complications of the disease, not a treatment for the root disease. Therefore, beans are no substitute for therapeutic drugs and should not be regarded as a sacred method. In fact, the effectiveness of the cure of diabetes with beans depends on the location, the method, and the persistence of the patient's use. Folk remedies often take time to see the measurement effect that cannot be expected from the disease in a few days of use. Cabbage is usually only considered for people at risk of diabetes in order to control blood glucose levels and prevent diabetes from developing. Although not an immediate cure, the use of beans for diabetes is an easy-to-do and safe way to maintain stable blood glucose levels. Therefore, it can be considered a useful support method, parallel to following a treatment plan and consultation from a doctor. Note when using beans. For people with kidney stones, avoid excessive use of beans. Because it's rich in oxalates, it increases the risk of calcium oxalate stones in the kidneys and the excretory system. Beans can also cause digestive problems such as bloating, diarrhea, and cramps, especially for people with intestinal problems due to high fructan content. If you are using metformin for the treatment of diabetes, note that beans can reduce the effects of this medicine, so you should not take beans at the same time as metformin. 2. Cabbage. This is one of the vegetables familiar to many families. Not only does cabbage contain important nutrients such as vitamin C and vitamin K, they can also effectively control blood glucose. According to many studies, this vegetable can manage type 2 diabetes. Cabbage contains many anti-hyperglycemic antioxidants that help inhibit the absorption of sugar after a meal. At the same time, increases the sensitivity of insulin to the metabolism of the substances of the organs in the body. For diabetics, the daily use of cabbage juice has a very good treatment support. lowering high blood glucose levels, limiting fluctuations, and helping to keep blood sugar levels within a safe range. In a 2008 study, researchers fed mice with cabbage for 60 days, resulting in lower blood sugar levels, which remained stable. However, there are also some notes when using cabbage for diabetics. Although it is a very good vegetable, when using cabbage for diabetic patients, you also need to pay attention to the following issues. Quantity. Cabbage is low in sugar, but contains some carbohydrates. Diabetics need to control the amount of cabbage they eat in a meal. A portion of cooked or steamed cabbage of 100 to 150 grams is suitable. Side effects. Cabbage juice can be annoying to some people, especially when drinking too much. Some side effects may include bloating, indigestion, abdominal pain, or constipation. Quality control. To ensure the best quality of cabbage juice, you should use fresh cabbages and do not contain any preservatives. Processing. The diet is important for diabetics, and it is recommended to eat boiled or steamed cabbage instead of scrubbed or roasted to retain nutrients and reduce fat and calorie intake. Blood glucose monitoring. After eating cabbage, diabetics need to monitor their blood sugar levels to see if a meal has affected their blood glucoside levels or not. 3. Broccoli. Broccoli are known to reduce inflammation, fight certain types of cancer, support cardiovascular health. In particular, they are also considered to be vegetables that control blood sugar levels. It's recommended for diabetics because of the sulforaphane extract found in this vegetable. Sulforaphane is a nutrient found in berries, such as soup, Brussels berries, and broccoli. This substance has the ability to activate enzymes with protective functions to limit damage to cells caused by high blood sugar levels. Furthermore, studies in mice have shown that sulforaphane has the ability to reduce the production of glucose in the liver and blood sugar levels when hungry. A portion of 62 grams of beets contains 5 grams of fiber and 50 calories. So this floury vegetable is suitable for diabetics who want to lose weight. One study suggests that if a type 2 diabetes patient eats pepper in moderation, insulin resistance is likely to decrease. This vegetable is rich in fiber, so it also regulates blood sugar levels to the right, stable level. Therefore, broccoli is considered a natural remedy that can keep blood glucose at a safe level. The study was published in the journal Science Translational Medicine. Scientists in Sweden have found a compound called sulforaphane found in broccoli vegetables such as blueberries, Brussels cabbage, and cabbages. The team tested sulforaphane on 97 patients with type 2 diabetes for 12 weeks. These people were supplemented with an extract of broccoli in powder, a dose 100 times greater than that of a normal broth. The results showed that it improved the patient's ability to control glucose levels and decrease glucose production. However, for non-obese people, sulforaphane has no effect. But for obese people with type 2 diabetes, it reduces blood glucose levels on hunger by 10%. Dr. Anders Rosengren, lead author at the University of Gothenburg, Sweden, said, "This study opens up new hopes for the treatment of type 2 ADHD. Because for people with obesity, excess fat in the liver makes the body less sensitive to insulin, which makes it difficult to regulate blood sugar levels. People with type 2 diabetes are advised to change their diet to control their blood sugar levels and to take supplements such as metformin. However, supplementation is accompanied by side effects such as 15% of type 2 diabetes patients have reduced kidney function, increased risk of lactic acid infection, discomfort, muscle pain, fatigue. About 30% of metformin patients experience nausea, abdominal pain. Finding alternatives to metformin is one of the researchers' goals. Sulforaphane does not cause digestive problems like metformin. 4. Bitter melon. Bitter melon helps control blood sugar. The effect of bitter melon on diabetes is to reduce blood sugar, control blood sugar in a stable way. The anti-diabetic active ingredients in bitter melon include carantia and vicine, which help lower blood sugar. Polypeptide P works similarly to insulin, converting blood sugar into energy, reducing blood glucose. Clinical trials show that taking 2,000 milligrams of bitter melon per day significantly reduces blood sugar in patients with type 2 diabetes. Bitter melon also helps increase the process of glucose consumption of cells effectively, supporting the easy transport of glucose to muscles, liver, and fat. Limiting the formation of glucose in the blood is also another benefit of bitter melon. Preventing diabetes complications. Bitter melon has the effect of preventing common complications in diabetics, such as cardiovascular disease and obesity. It helps reduce cholesterol buildup in the arteries, reducing the risk of cardiovascular complications. The high fiber content in bitter melon helps prevent obesity, helping diabetics control their weight better. Although bitter melon is very effective for diabetes, excessive or frequent use can cause unwanted side effects and affect the effectiveness of other medications. Here are the potential risks and complications that can occur when using bitter melon excessively. Using too much bitter melon can cause vomiting, diarrhea, and other intestinal problems. Using too much bitter melon can cause miscarriage, uterine contractions, or vaginal bleeding. When using bitter melon with insulin, blood sugar levels can drop to dangerous levels. Using too much bitter melon can damage the liver. Using bitter melon with certain other medications can change their effectiveness. Using bitter melon after surgery can cause problems in controlling blood sugar. 5. Eggplant. Eggplants have a low glycemic index, GI. So many people believe they can help control blood sugar well. The high fiber content in this fruit slows digestion and absorption of food, keeping blood sugar stable and preventing spikes. Polyphenols in eggplant also stimulate insulin production, while reducing the risk of sugar absorption and protecting the body from diabetes. In addition to its benefits for blood sugar, eggplant is also popular for its effects in preventing cancer, maintaining stable blood pressure, enhancing resistance, and supporting weight loss. However, it is important to monitor health regularly and carefully, even when consuming foods that help control blood sugar. Along with diet, each person should maintain a healthy and scientific lifestyle to prevent disease. We have just introduced 5 types of daily foods that help control blood sugar and support diabetes treatment. Learn about them and apply them to your daily meals to help limit the risks of diabetes. If you find them useful, please share this information with your friends and relatives who are at risk of cardiovascular disease and diabetes. Don't forget to subscribe to the channel to stay updated with the latest health videos.